My name is Asiya, and I'm going to be presenting on myths, medicine, and Muslim youth and the importance of religious considerations in effective global health initiatives. First, here's a quick introduction about myself. As a rising junior at Morristown High School, I've had a fascination with the importance of healthcare for several years. In addition to starting a global health club at my school, I shadow a physician at a local free clinic where I've learned a lot about the healthcare system as well as doing research on health myths affecting Muslim communities, which I'll touch upon in a moment. I started a free tutoring service called Brilliant Beginnings, and I've played the piano for 10 years. I hope to pursue a career in global health, but more than that, I want to be a part of a generation that makes healthcare more inclusive and informed by the cultures and values of the people it serves. The topic of the intersection of global health and the Muslim faith is very important to me and many Muslim girls and women around the world because I'm a Muslim American and I've grown up around questions such as, what medications are halal, which means lawful, or haram, meaning forbidden? What do I do if I get my period on a school trip and can't ask anyone? These aren't just religious questions, they're global health questions too. And too often, young women like me don't get the answers we need. This topic matters because 25% of the world is Muslim, and yet so many global health campaigns don't speak to us. Culture, religion, and trust deeply influence what we believe, and yet youth-centered, culturally respectful information is rare. A 2021 report by the British Islamic Medical Association found that culturally appropriate communication was one of the top drivers of vaccine uptake in Muslim communities. That means how something is said and who says it can make all the difference. When we talk about global health, we often focus on infrastructure, access, and funding, but we sometimes forget about the social and cultural realities young people navigate daily, like shame, family pressure, or religious misunderstandings, which are just as important. Health myths travel really fast. One MIT study found that false health information spreads 6 times faster than true facts on social media. That's especially dangerous when the myths are about medicine, periods, or religious rules. These are just a few of the myths I've heard from classmates, social media, or even adults. Many of these stem from confusion between culture and religion, or a lack of open discussion. Some teens are scared to use tampons because they're told it takes away virginity. Others skip life-saving vaccines because someone on TikTok told them they weren't halal. Even menstrual health is surrounded by shame, leading to silence or avoidance of care. When you grow up hearing the same thing from multiple places, whether it's family, school, or online, you start to believe them without ever checking if they're true. The lack of clear education leaves room for misinformation. These messages spread faster than facts, but at the same time, youth don't always feel comfortable asking parents or doctors. And doctors might not know what to say either, and the result is hesitation, skip treatment, and stress. We need better answers and better messengers. Doctors need to be trained to understand, not dismiss, religious health concerns. Muslim youth need spaces where asking, is this halal, isn't seen as weird, but normal, and we need global health campaigns made with us, not just about us. So what does it mean for medicine to be halal? It's about process, intent, and whether there's a valid medical need. Many scholars agree that life-saving treatment takes priority, even if a medicine contains questionable ingredients. Many Muslims aren't against medicine, they just want to know if it's safe and halal. In the UK, nearly 1 in 4 Muslims said they had refused treatment simply because they weren't sure if it aligned with their faith. That's why cultural and religious sensitivity is so important in health education. Menstruation is one of the most misunderstood and silenced health topics for Muslim girls. Some of us were taught we can't talk about periods and tampons even though they affect our ability to pray and fast. In one survey by UNICEF, girls in South Asia reported missing school for days every month during their period. Not just because of pain, but because of shame. And in many places, religious confusion adds an extra layer of silence. This creates embarrassment, confusion, and even fear, and it doesn't have to be that way. I ran a survey with over 50 Muslim teens, and the results confirmed what I suspected. Many said they weren't confident about whether their medicine was religiously allowed. Some didn't know where to go to for health information. A big chunk believed myths about tampons, periods, or vaccines. Some of my findings were that 88% had heard of a health myth in their community. Only 13% were sure about which medicines were halal and which were haram. 44% did not feel like they had enough clear information about what they can and cannot do during their periods. And 77% would be interested in resources, like videos, cards, or workshops that explain health and medicine with respect to Islam. That last number was the most exciting to me because it shows that youth are ready for change. They just need support. These numbers aren't just statistics, they're a call to action. They show that many Muslim youth are navigating health decisions without the clarity or culturally sensitive resources they need. Misinformation isn't just confusing, it can lead to shame, skip treatments, or distrust in doctors. That tells us we need better peer education, more relatable health messaging, and safer spaces for questions. And most importantly, we need to stop treating cultural and religious beliefs as obstacles and instead recognize them as essential to creating real health solutions. We don't need to wait for the perfect solution to come from the outside, because the most powerful change can start within our own communities. One idea: youth-led workshops where teens bring in both a doctor and an imam. That way we can get answers that are medically accurate and religiously informed, all in the same space. Another option: an open Q&A circle just for Muslim teens. A safe, no-judgment zone where we can ask what we've always wondered, like, can I take medicine while fasting? Or, are vaccines really halal? Schools can also step up by making their health education more culturally aware, explaining puberty, menstruation, or vaccines in ways that connect our values and beliefs, not ignoring them. Distributing resources with real versus myth information on periods, vaccines, and more to mosques and schools will also help to educate the public and leave their questions answered. And at the end of the day, what matters most is inclusion. Muslim youth need to be in the room, in the conversation, and leading the way. When health education reflects both science and faith, that's when it truly works. Because in the end, we're not choosing between religion and health. We're choosing understanding, trust, and care. Myths and silence have power, but so do we. Muslim youth deserve to learn about our bodies, our health, and our religion without shame or confusion. We deserve to ask questions and get answers that make sense, both scientifically and spiritually. I believe that informed youth become empowered leaders, and when we combine medical knowledge and cultural understanding, we don't just fight misinformation, we build trust. That's the foundation of better health for everyone. And while my focus today has been on Muslim youth, these challenges from shame to misinformation show up in other communities too. Jewish, Hindu, Christian, and other youth of faith also need health information that speaks to their values. I hope this presentation inspires more open conversations, better health education, and trust between generations. Thank you for listening to my presentation, and thank you to the Johns Hopkins Global Health Leaders Conference for allowing me to present on Muslim health myths. I hope you learned something from it. Here's my contact information, and here are my references. Thank you again.